Good morning, everyone, and welcome to our last Primetime of this season. Primetime is a collaboration between the Friends of the BU Library, Academic Affairs, and other offices on campus and celebrates learning in and beyond the classroom of Bethel faculty, students, and staff. You can find videos of past Primetime events on our YouTube channel, Bethel U Dig Lib, and through our digital collections on the library website. This morning, we are honored to be welcoming 4 students who are graduating with the Health Endorsement certificate this spring. They've worked incredibly hard, and I'm so excited to be able to celebrate the amazing work that they've been doing, both at Bethel and within our greater community. A little bit about the Health Endorsement. Students commit to this pathway during their fall of their sophomore year. They take a few required courses such as Intro to Healthcare. They take communication courses, they take ethics courses, other technology themed courses. And what the real hallmark of this is that they do an internship of their choice. And what's so special about this is that we have the chance to envision what healthcare looks like outside of that clinical degree. And one of the things that we know is that this is a growing area. We need people that are understanding of the healthcare world, and that's exactly what we're going to do today. So I'm going to go ahead and turn it over to our first presenter, and I'll have each of the students introduce themselves when they get up here. We'll do Q&A at the very end, so please keep those questions that you might have so that we can go ahead and dialogue a little bit with them when we're done.
Hello, everyone. My name is Esther, and I'll be talking to you about the internship that I completed this past spring semester. So I was with Hennepin Healthcare, and underneath Hennepin Healthcare is what they call Community Action Partnership of Hennepin County. And they have a couple programs that they provide to Hennepin County community residents. And so I was serving within that population in that community. And then a mission statement that I wanted to point out for Hennepin County is on the screen here. It says, partner with the community to provide effective and responsive services to reduce the impact of poverty in Hennepin County. And then this is their vision statement, Hennepin County without poverty. So I also wanted to just bring up a really important quote that I feel like highlights, again, kind of the mission and vision. And it's just the statistic. It says, in Hennepin County, roughly 1 in 10 people are living below the poverty level. That means that more than 120,000 people cannot meet their basic needs. And when we think about basic needs, we think about like housing and water and food. And so 120 people cannot, or 120,000 people can't meet that in Hennepin County, which is a pretty big number if you think about it. And then again, Community Action Partnership of Hennepin County offers a variety of programs to assist the needs of lower income residents in the community. So the program that I worked with specifically was the tax assistance program. It was called FIDA. And I worked closely with my preceptor. Her name was Latarian Adams. And then you'll also notice that it was kind of made up of a group of just like random individuals. Like I was the undergraduate intern, and then we had an accountant, we had retired people, like it was just a hodgepodge of different people. But in that, everyone kind of brought their specialties together to make this program happen. Going into a little bit of the determinants of health in the community, a lot of the clients that we worked with, unfortunately, dealt with some of these things, such as lower income job crises or unexpected emergency. An example of that would be, I had a specific client who their mother was ill, and so they had to be their mother's like primary care provider, which kind of made it so that they weren't able to have a separate job other than that, because their primary job was taking care of their mother. And then lack of education was also one of the determinants of health. So all of these things kind of played a role in the community members experiencing poverty. In my learning plan, I identified with the mission and vision of the organization through working with underrepresented populations of people. There's a lot of different people that came in for assistance, and that was one of the highlights, was just being able to collaborate and work with a lot of different kinds of people. And then also providing access that is an essential service in an effort to increase equality. These residents being able to have their taxes done for free was actually a really, really, really big deal, because then they could use that money that they would have had to allot to something like an accountant or H&R Block, and maybe would have had to spend like $500 to do so. They could allot that money instead to like a savings account or something else that was really a pressing need in their life. So my role in my internship was, I was kind of I had two different roles. On Mondays, I would kind of be more of the administration and organization role, where I was in the office handling phone calls and emails and scheduling clients. And then we had in-person clinic days on Tuesdays, Thursdays, and sometimes Saturdays. So those are the days where we were meeting with clients in person, and I was the front desk greeter. So I was kind of checking over paperwork and making sure that they filled it out correctly, because I'm sure a lot of you know, like, the IRS is no joke. And so you have to make sure you fill that out correctly so you don't get in trouble with the IRS. So that was my role. And then a little bit into client testimonies and just the experience. Again, many clients really needed this service, and so the fact that we provided it for free was really helpful for them. And then I just wanted to touch on some of the memorable clients that I had. There's one client in particular who I got to know pretty well. Her name was Lisa Butts. And not only did she just joke about the fact that her last name is Butts, but she was just really, really, really personal with me. I got to learn a little bit about her story, and I think that made the experience that much more impactful, knowing her story and knowing how much the service helped. So now I just kind of want to touch about a little bit about the successes and challenges of my time there. I'll start with the challenges because it kind of seeps into the successes of it. So we did have a little bit of a rocky start. The first thing we were doing we were just scheduling in-person appointments, but a lot of clients had to drop last minute, which is really unfortunate, because when we have volunteers coming in and giving their time, having people drop out last minute just means that we're sitting in a room expecting clients and no one's coming. So that was one of the challenges we faced. And then we also faced some rude clients, unfortunately. Some people who just kind of expressed their distaste for whatever reason, whether it be their situation or whether it be their experience with us. And then we also experienced the challenge of people not wanting to comply with the IRS guidelines, trying to get free money from the government when they weren't supposed to. Like, some people were kind of, trying to lie and like just say different things about their circumstances. And so that was a challenge that we faced. And then some successes that we encountered was actually reinventing our system with drop-off appointments. And that was really, really helpful in getting more people the help that they needed, because people could come in, fill out the paperwork, and then they could leave. The in-person appointments I'll mention was somewhere about like an hour and a half to 2 hours, but then the drop-off appointments were only 30 minutes. So not only was it efficient, but we were able to serve more people. And then another success of my internship was the organization system, and then the positive client interactions that I talked about earlier. And then here are some of the project outcomes that I was able to accomplish. I gained IRS volunteer certification in basic tax return. So if you have a basic tax return and you need it to be completed, I'm your girl. I also provided front-of-the-line support for our weekly tax clinic. So I was the main person interacting with clients and getting them help. I aided in recruiting clients for our free services through phone calls, emails, and other forms of communication. And then I also helped in making client experience a positive one through quality service and support. And then I also gained valuable once-in-a-lifetime experience just working with the volunteers in my preceptor. And now I'd like to touch on some takeaways. I think, first of all, it's really important to holistically view the people that you're working with, especially in non-clinical roles. When you're helping people and you're meeting them, whether they're different than you or whether you do have similarities, I think taking into account just everything that it is that makes them who they are is important to best suit and meet their needs. I also took away that respecting and valuing all people that you come in contact with, despite the differences that you have, is really important as well. And then lastly, I learned that it's really important to go high when people go low. Going back to some of those rude clients, like, it would have been a different experience had I maybe taken what they were like throwing at me and kind of like met them there. But instead, I think it's really important to go high and to share the love of Jesus with people who have never maybe experienced it. Thank you. That's all.
All right, so if you guys don't know me, my name is Lucas Johnson, senior here, graduating this spring. Plan is to end up coaching, training athletes after I graduate with my biokinetics degree. And yeah, I'll be at a high school and at a private practice as well. So I'm going to talk about one of my internship experiences I had last summer. It was at a integrative medicine clinic in the Wayzata area, and worked with a Bethel grad who's a PA there mainly, and she does functional oncology, integrative medicine. Learned a lot from her. And so to kind of get you guys a background picture of what I learned, what the clinic's about, I'm going to tell you guys a brief story about a patient. This patient wasn't directly at Lifespan. I didn't get permission to share a story, but this is someone who I think paints the picture very well of what an issue is that they address. And so Cassidy Armstrong is a young woman, 36 years old. She was feeling a massive, severe pain in her right side of her torso. And she wanted to get checked, get some blood work done and an x-ray, and everything came back normal. Nothing seemed to be wrong. And so with that being said, within the year, things took a turn for the worse. So she became anemic, she lost 25 pounds, and the pain in her right side was just getting worse and worse. And so clearly something was very wrong. And so she went back into the clinic and they ran an ultrasound on her and found that she had a massive growth on her liver. And so they initially diagnosed it as a rare cancer that strikes people under 40. And they didn't want to run a biopsy because of fear the cancer would spread throughout the body. And so they decided to remove it. So they removed her whole gallbladder, 2/3 of her liver, they scraped her diaphragm, and they removed parts of her lung as well. And so they removed all that, severe procedure, and then under further study of the mass that was removed, they found that it wasn't actually cancer, it was parasitic growth. This was a parasitic infection caused by a tiny tapeworm. And now, after that was removed, she's doing well, she's on anti-parasitic medication. But with the initial diagnosis and no biopsy taken, they thought it was cancer, and clearly it was not, because parasites can behave like cancer, spread to different organs of the body. And so this is kind of the tip of the iceberg for what we would see. We would see people come in with things like different types of cancer, chronic Lyme disease, chronic illness, cardiovascular disease, gut dysbiosis. And we would see these things and would look to find the deeper issue and cause of these illnesses, because yes, they're present, but okay, why is this going on? What's causing that? And so a big idea concept was to think of the body as a garden. And so if a novice gardener saw that plants weren't thriving and weren't doing well, you might spray some weed killer, hope for the best, we'll see what happens. But a more intelligent gardener, one who's more connected with the earth, with the environment, would ask deeper questions of what's going on. And so he would ask, all right, does the soil have proper minerals in it? Is it getting enough nutrients? Are the seeds healthy? Is there environmental stress blowing on the plants? Is there toxins seeping into the soil? And so these are all in-depth questions that you have to ask in order to address the mind, body, spirit system, not just the physical body. And so this is a quote from a doctor that they worked really closely with at Lifespan, Simon Yu. He's an MD in Boston. And he says, we need to think differently. We must correct the underlying problems that cause our illnesses. And by doing so, our bodies correct themselves and return to optimal health. Because our bodies are always working for us. We just have to get on the same page as our body. And so what I did at Lifespan, I worked with Alicia Hickson on the top there. She's a Bethel grad. She's a PA at Lifespan. I worked mostly with her, but I also shadowed nurses, and I worked with another doc, Mark Rossen. I was able to interpret labs, help patients understand blood work, give them clarity of mind if they have questions on anything, help them with like their schedule. And at the end of the internship in August, I was able to teach their first ever class on alternative treatments to cancer, which was really cool. We had like 20, 30 people come, and it was cool to hear a lot of the positive feedback, and it seemed to be really helpful for the patients. So, a couple other things I picked up and that I think they embodied really well at Lifespan was empowering the patient. I sat in on countless patient visits and check-ins, and the number one priority of Alicia was to educate and build up the patient so they feel confident and they feel like they have a chance at what's going on in their life. Because at the end of the day, you heal you, and you gotta not feel a victim to the world around you. And so she's able to build up and restore that confidence in people, which is really cool. Another thing that I figured out if you want to be successful in the healthcare field is that you cannot just rely on your college education, even post-grad, and that this is a lifelong learning process. You're going to be learning all throughout your career, and you have to have an open mind, never stop asking questions, challenging ideas, and doing research. Like almost every day, I think Alicia showed me like a new research article. She was like, look into this, see what's down this rabbit hole. And it was really cool to be flooded with that much information by someone. And yeah, just taking the principles learned, the raw materials of this schooling and apply them to problem solve later on is a huge key of being successful. Another thing that they did really well is they worked with a ton of great doctors and PhD researchers. So Alicia was someone who got connected. She was very bold and just reached out to everyone. She reached out to some doctors she looked up to. Simon Yu is a very successful doctor on the forefront of cancer research. Nasha Winters is incredible as well, and Thomas Seyfried has some really cool research regarding how cancer works, what it is, how it operates, and they're able to create this like web of possibility where if they don't understand something, they can refer a patient to Simon Yu, or they create this web of possibility, which is really cool. And so, I guess we're at the end. And so if you guys take anything away from this, hope that you just remember that the metaphor of a garden is very applicable to be applied to the body. Ask deeper questions and understand that your body is always working towards your health. And yeah, it's not against you, it's for you. So thank you guys for listening, and hope you learned something.
Okay, hi. My name is Thrun. I'm also graduating this year with a communications degree. I have the healthcare endorsement just as a little extra oomph, and I'm excited to share with you what I learned in my internship. So I actually got an internship at Bethel through Student Life with Alicia Oakes and Christy Erickson called Be Well at Bethel. It's a new internship that they started this year. So I was super excited to be kind of a guinea pig and experience the new internship with them. A little bit about kind of the mission of Be Well at Bethel. It's about holistic wellness, well-being, and mental health of students at Bethel. We work to collaborate across campus to create opportunities for students to engage with and experience. We focus on proactive, preventative strategies to promote emotional, spiritual, social, physical, and cognitive well-being. So we did a lot of work, and it was super fun to interact with different offices and different people throughout campus. Something that was really fun was some of the events that we did was collaborating with the Wellness Center or the ORS office and working to provide resourceful resources for students. So I'm just kind of going to walk you through what my fall looked like with Be Well at Bethel and kind of the things that we did to support the wellness of students. So in August and September, we kind of started slow. We did a glow yoga night that was instructed by a yoga instructor, and it was dim lights, glow sticks, so it was super fun activity. One, to offer students a chance to experience yoga. There's so many benefits to yoga, so that was super fun. And then we also did some passive programming, just providing flyers and other resources to students. In that way, we kind of made posters that RAs could hang up in shack or the lobbies of different residential dorms. So that was an easy start to the internship. And then October was a busy month. We had a marijuana panel that actually Professor Bilby was in on, and a few other people. They talked about like the theoretical perspective, moral perspective, and the health and well-being perspective of marijuana and the use of it. So that was super cool. We also did Stress Less kits, which is typically a pretty big hit by Bethel students. It's just something we do in the BC. We have a big table of fidgets and tea and all the things just to promote a less stressful school year or school week. So that was super fun. We did a resources campaign, which was creating Mental Health Matters, which is a poster that I'm pointing at. I got to design that, so that was super cool. You might have seen it around campus. So got to do that. We made a relaxation handouts, just providing students with tips and tricks to relax, meditate, whatever that looks like for them. And then also made informational poster about warning signs of suicide for friends or yourself, just providing extra resources to students if they see that they need it. And then a fun little activity that we also did was Puppies and Puppy Chow. That was also in the BC. And I mean, it was kind of just to get students around and talking and gather together. Pet some puppies, eat some puppy chow. There's nothing wrong with that. So that was super fun. And then in November and December, we took it low-key, finals week and holidays and everything, and we handed out little journals before and after a chapel one day. And we just, with the journals, we passed out ways to journal like gratitude and just directions to guide students if they saw that they wanted to do that. So that was super fun. And then similar to Puppies and Puppy Chow, we hosted a dog and donuts event. So yeah, I want to talk about my personal takeaways for like in this experience. I would say the first thing is the simple impacts. I mean, what we did, like Puppies and Puppy Chow, it's a pretty low-key event, not super high strings attached, but it got people talking, it got people gathering, and I think that that's just a great example of, I mean, it doesn't seem directly correlated to mental health, but I mean, it is. It's, you know, enjoyment and getting together as a community, so that was super special. Another thing is just like the importance of mental health. I think now especially it's becoming more socially acceptable to talk about mental health, but it hasn't always been that way. And so to be involved in an internship that really promotes this and spreads word across and creates opportunity for students was super cool. And then another thing was being behind the scenes, creating the posters, brainstorming for the events that we hosted, and seeing them follow through and being successful events for students that they enjoy and they want to see happen again was super exciting and encouraging, just a testament to how relevant mental health really is to students and the student body and the staff. So moving forward, like more kind of takeaway things, how I see this progressing throughout life is just like, again, the reality and the presence of mental health. It's always going to be relevant. It's always going to be something that we all experience and go through. So, I mean, just shedding light on it and continuing to allow a conversation for it to happen is super awesome and exciting. And I think it's a great opportunity, especially in college as we prepare for the real world. I think another thing moving forward, I feel very encouraged to make this topic more visible and accessible. Moving forward after graduation, I'll be working in HR, and I think this is super applicable to HR, as it could be an issue that comes up with employees and coworkers. And so I think being aware of it will just create a fresh perspective on life after school, in the workplace, all the things. So yeah, I'm excited to bring it into my career, and I feel very blessed to have had this opportunity. So thank you.
But my name is Ebaisin, and I am a community health major here at Bethel with a double minor in bio and psych. and now adding endorsed by the Healthcare Endorsement at Bethel. So that's kind of my very brief introduction. And the focal point of my internship was mental health in the Black community. My volunteering or internship experience was at a therapy clinic that I'll talk to you guys about a little bit later in my presentation, and my role there was an admissions coordinator, but I did a lot more. It was a very diverse role as kind of the assistant and a bunch of other things. Yeah. So I just wanted to talk about some of the ethical considerations that took place with my internship. When it comes to ethical considerations related to mental health in the Black community, there are a number of factors to consider. Some of these include the ones listed here. That includes history, cultural mistrust, bias and stereotyping, barriers due to access, cultural stigma, historical trauma, and cultural mistrust. It would be unfair to attempt to resolve issues related to the lack of mental health support for Black people without first acknowledging the very lengthy history around it. Black men and women have been exploited in areas of science for centuries. Studies such as the Tuskegee syphilis study, when penicillin was withheld from Black men with intentions of observing natural progressions of the disease, or experiments done by J. Marion Sims, who was known as the father of gynecology, who performed surgical experiments with no anesthetics, and other science experiments such as eugenic programs that involve selective breeding and sterilization of Black men and women throughout the United States and in the early 20th century, which is very recent, shows that there has been a lengthy history of people of color and Black people being neglected in the areas of care. The injustices that Black men and women have experienced in healthcare is no tale or folklore. It's very real, tangible. There's evidence behind it, even in the discipline of mental health. Historically, Black men and women have suffered due to these injustices. And in January of 2021, the American Psychological Association released an apology for their shortcomings related to perpetrating, promoting, and failing to challenge and address racial discrimination and the history of corruption resulting from human hierarchy in the U.S. And it's kind of small, but I can read it for you guys. The apology reads, "Today, the APA, the oldest national physician association in the country, is taking an important step in addressing racism in psychiatry. The APA is beginning the process of making amends for both direct and indirect acts of racism in psychiatry. The APA Board of Trustees apologizes to its members, patients, their families, and the public for enabling discriminatory prejudicial actions within the APA and racism practices in psychiatric treatment for Black, Indigenous, and people of color. The APA is committed to identifying, undertaking, and rectifying our past injustices, as well as developing anti-racist policies that promote equity and mental health for all." And following their apology, the APA actually changed their policies, and they're in the process of implementing new regulations and policies to protect people of color and to prohibit history from repeating itself. And so when I think about some of the challenges of my internship, is a lot of it goes to gaining trust, breaking barriers, lack of participation, repetition of history, providing culturally competent providers and resolutions. Since there is this historic challenge that exists with receiving care, it's kind of hard to get people to come and get care. Some people just are used to maybe feeling like their providers are falling short, or just feeling disappointed, or just uninterested, or maybe misled by stigmas and misconceptions. And so for this reason, a lot of our struggles was really just getting people into the clinic, which kind of walks to my approach. I kind of created a slogan or a hashtag, I guess, that says "Transforming Together, Empowering Change from Within." So my approach was very heavy on co-creation, community engagement, collaboration, community-based research initiatives, and action-oriented change. And then some benefits of these different ethical models of decision making was that they led to more engagement, more community empowerment, more people willing to get involved, equity, regaining trust, bringing hope for the future, and overall improved health outcomes. And then these are some examples of the ethical models that I use, including community-based participatory research, cultural competence models, and anti-oppressive practices. which leads to my internship. The location of my internship site is called Omni Healing Wellness Center, and it is ran by Kiara Owens, who is the CEO. She worked for many agencies in the metro area for years, and throughout her years of working, she realized that a very real disparity of professionals who practice with a culturally responsive social justice and top-down approach existed. And she also noticed that it was apparent that those who have been historically underserved and marginalized would also report feeling disconnected from their providers. So Kiara reported feeling a responsibility and need to change what she saw. Eventually, that very same feeling helped her to see through an opportunity where she could combine a strong sense of community richness, of diversity, inclusion, and provide into a clinical environment that embraces the wellness of its community and its patients. And the population at Omni Healing is very diverse. It's not actually limited to just Black people. It's open to people of color, but more specifically individuals from underserved and marginalized communities. And I just also want to highlight that Kiara is actually amongst the only 1% of Black mental health providers in Minnesota and the 5% in the United States. And so when I think about a few areas where I gained knowledge, values, and skills, I definitely was brought a lot more awareness about this issue and the severity of it and the continuation of this issue. I also gained a lot of advocacy skills because we did do a lot of community engagement. We got out in the community, did a lot of promo, so I was able to talk to people, hear their experiences and what they shared. I also learned a lot about interprofessional collaboration, professional networking, professional growth, shared decision making, and I was able to make a lot of personal reflections and just overall improve on my research skills with the research that I did for one of my other classes. And so when I think about my exposure and how it changed my understanding of academic discipline, I definitely got to learn more about practical application, cultural competence and its importance and significance, interdisciplinary teamwork, ethical considerations when engaging in research and just studying people and their experiences. I also learned a lot about how research is endless. Like discussed earlier, there's always room to learn, and so that was something that I very much learned throughout this process, is that you're never going to know it all, so continue to read, continue to educate yourself independently, and just the importance of human connection, just being able to sit with people and have these conversations was very impactful, and I'm sure that it will be a big part of my testament and my testimony in this path, which leads to intersectionality. So my area of study moving forward is actually going to be law. But I did spend a lot of my undergraduate time doing healthcare stuff. And so in regard to like Omni Healing, some things that I considered was that I gained awareness, I gained intervention skills, innovation skills, understanding and promotion of well-being, which connects to community health, because those things that can happen in the rooms with the patients can lead to overall community empowerment, more community education and prevention, intervention as well. It could also reduce detriments, social detriments, and improve public health overall. And that ties into my area, which is law, because these changes could also lead to changes in policies like the APA, regulations, legislature, very heavily stand in advocacy for ethics, health equity, changes in public health laws, human rights, and legal advocacy. And so even though I'm not necessarily going into like healthcare moving forward, malpractice law is definitely something that I can explore. And so that's like an area where I can see a lot of my work in my undergraduate studies connecting with law. And then this was actually some information that was obtained from my research that I did for my internship course. And this was like a survey and some of the stats. You could just kind of look over. It was a lot to break down, so I'm not going to go too deep into it. Plus, I want to make sure I'm still on time. But yeah, so hey, in like 5 seconds, you can get what you get. If you want to learn more about it, you can contact me. I got you with the info. And then this is my references, and that's all. Thank you.
Thank you so much to all of our presenters. I'm going to go ahead and open it up to any questions from the audience now. So if you've got a question, if you just want to let me know, and I'll bring the microphone over so that you can ask it of our presenters today.
Thanks. Nice job, everyone. That was very good. Question for Lucas. I really like the illustration of the garden, this like the prosperous garden that you showed versus the more worked up ground that was overused. How do you apply those concepts to your own life to live a more holistic way where your body is just flourishing and it's healthy?
Nice. Great question, Travis. Thank you for asking. Yeah, for me personally, I think a big thing, like I said earlier, if something is kind of out of balance in my life, that let's say I get a cold or something or whatever, I take a deep look kind of within what's going on in my life. Am I kind of overwhelmed with stress? Am I eating tough food? Am I not getting outside and I'm not getting sunlight? Am I not connecting to the earth? Am I not connecting with people? What's going on? And I really try to, focus on what I eat, eat clean.
What does that look like for you, eating clean?
The biggest thing, so Travis asked, what does eating clean look like for me? I think the most important thing to think about is sourcing. So like where you get your food, the quality of food. And I try to stay away from processed foods, just eat good meat, fruits, vegetables, clean stuff, a lot of honey. And yeah, I don't know. Does that answer your question?
Yeah, absolutely.
Cool. Thanks, Trav.
That's a great question, especially as it's allergy season right now. I don't know if anybody else is struggling, but I've definitely been thinking about these things. Other questions?
Yeah, I'd just like to hear from each of the presenters what drew them to pursue the healthcare endorsement in the first place.
I think for me, I think for me, through like all the different courses we were able to take, I just feel like a better, like well-rounded person going into the real world and working in a professional space. And I think also my internship experience just helped me to better understand like what path I wanted to take and where I wanted to end up afterwards.
Yeah, I think that it's super applicable to a lot of things, and so the added knowledge I think is nice. I also came in as a nursing major, and so I had a couple classes under my belt, and I was like, well, might as well, just add it to the resume. So it was nice and convenient, but it was also, I think, that I've learned a lot from it, and I'm thankful that I did it. So.
For me, coming in, I knew I wanted to do something related to health. I wasn't completely sure on what I wanted to do. And I knew the healthcare endorsement would just help expand my understanding of the ethics of health. And just the big thing for me was like getting exposed. And so like with this internship experience, I was able to kind of figure out what I did and didn't want to do. So I'm not going to PA school right out of school. I might possibly go back to pursue this, but for now I'm going to end up coaching like I told you guys earlier. And so this was just a really helpful experience to get my hands dirty, figure it out, get some personal experience in the field, and just figure out answers for myself. And so it was great.
I think for me, a part of it was really just as I was coming to an end with my degree, I wanted to do something that helped me to know what direction I was going in healthcare. And so I think without even knowing that I was going to be completing the healthcare endorsement, it just helped me to explore where I kind of fit, and also just to be able to reflect on my experience on this path. And I did work a lot of jobs in healthcare, so I think it just helped me to look back and really just discern what was meant for me, what I enjoyed, what I didn't, and to overall just share my experience.
And I think that listening to all four of your experiences shows us just how diverse it is and just the impact of all of these different pieces. Even something like making sure that people have access to their taxes. They need that information to receive benefits, to get healthcare. Just all these kind of niche communities that we don't always think about as we think about that holistic perspective. Looks like we have time for one more question. All right, I'm going to ask it. A lot of you talked about the idea of kind of further education and that this is something that we have to keep looking into. So my question is, what's the next question that you need to ask as you work towards healthcare in whatever area that you end up in? So what's the next thing that you feel like you need to learn to be effective at helping the communities that you are all so passionate about?
I don't mind going first. I think for me, just continuing to learn more about cultural humility. I've learned that cultural humility is a lifelong learning process, and I think just even getting close to being considerably cultural competent is my goal. So just continuing to learn through people, their experiences, really hearing it, believing it, despite our differences. I think that's kind of my direction right now. But more specifically to healthcare, just once again, like listening to patients and just hearing about where help is needed. Or yeah.
Should I go?
Go.
Yeah, I think the next question I'm asking myself is kind of what aspects of like my leadership skills and whatnot can I bring to the table to, because right now I'm going to be coaching kids, like how can I fit into this uniquely and bring my gifts to help these kids out with their sport, but also like with emotional health, psychological health, and just to not stop asking the questions in regard to like how can I help them in their athletic development and also their spiritual growth as well, and like implementing ideas and philosophies into that, how I coach, I guess. I don't know if that answers your question.
I mean, like I said, I'll be starting in HR, and so like that will look so vastly different every day, I think. And so from like a mental health perspective, I think something that I'll continually be asking myself is like, how can I ensure that the people within this company and outside of the company are receiving the support that they need, like in the corporate world, and like how can we continue to normalize the conversation around mental health and make people feel welcome in whatever stage they are in their journey to, navigate that for sure.
Well, similar to Faith, and I don't know about Ebaisin, were you also a nursing major?
I was.
Okay, so there's a trend here. I was also a nursing major, and then I switched over to community health. And I think for me, the biggest thing is like continuing to stay curious and kind of question these systems that are in place, because as much as there's a lot of good in them, there's also a lot that can be changed, and there's a lot that we can do better to better support people within healthcare. And so I think for me, it's just continuing to be curious and then apply my leadership skills and abilities to where I can make an impact.
Excellent, thank you. Well, I'm so excited that the four of you are going to be able to take these skills that you've been given and that you've worked so hard on in the last 4 years and take them out to the community. So thank you everybody for attending today. It's always such a pleasure to be able to celebrate our graduating health endorsement students and the last prime time of the semester. So thank you all so much.